Hello, everybody. I'm Nicole Rowe, one of the founding partners here at Aspire OT, and also I am an OTA still in clinical practice. Thank you for coming to hang out with us today. I'm here with Kim as always, and also a special guest. We have Karon Uzzell-Baggett with us, and we're just going to spend a few minutes chatting about kind of her experience with Aspire OT. And so I would just like to kind of start off, Karon, and just ask you what kind of comes to mind when you think about Aspire OT and the experience that you've had with being part of us, being an Aspire OT supporter?
Well, thank you so much. I really appreciate the opportunity to join you, Kim and Nicole. What comes to mind with me when I think about Aspire OT is just high quality, evidence based, which is critical for our profession. Practice and topics that really resonate not only with occupational therapists, which are certainly a primary audience, but I think really others can benefit too. I think occupational therapy needs to constantly be educating occupational therapists about how to, as Kim has frequently stressed, explain the distinct value of the profession, but also giving the U.S. and its state of its healthcare. We have all these advantages, but all these terrible health outcomes. I think constantly showing people that when you're considering something, consider asking for occupational therapy because of all the things that we can do. We look at not only what might be wrong with you in that moment, we're more concerned about the whole person and how to keep you living productively and doing those things you love to do, whether it's hobbies or these essential roles that you have to fill. And Aspire OT provides a high level of education to allow you to fulfill all your roles and continue participating as fully as possible.
No, I love that. I think we live in a challenging time for healthcare in general, for those receiving healthcare, but also healthcare professionals. But with those great challenges, I think those, like you said, there comes great opportunities. So I really appreciate that perspective. Um, Go ahead, Kim.
And so, for those who may not know, I'm Kimberly Breeden. I'm an occupational therapist in my 29th year of practice, both as an OTA and now an OT. I'm the other founding partner of Aspire OT. And Karon, you are a Just for OT subscriber. Thank you so much for being a subscriber. So, I'm going to put you on the spot a little bit. How would you describe the Just for OT subscription using just 3 words?
Oh, once again, value, quality, and just outstanding. I think all those the words kind of encapsulate what you all do. It is really wonderful, high quality programming at a great value.
Well, thank
And
you.
if I
We
could wedge
very
one
much
more in there,
try.
it's convenient. It's convenient because you're meeting the person really kind of at reasonable times after, work or whatever. And if for some reason someone can't make it because they're working a different shift, a mid shift or a night shift or whatever, it's on demand. So, like I said, I think you really are great.
I think it helps to be OT practitioners still in clinical practice. That helps us understand, we're dealing with those same challenges of productivity, documentation, always trying to make sure that we're providing best practice, being evidence informed. So I think that makes a difference, because when you have OT practitioners really sharing information and their experience with other OT practitioners. I think that is really important.
I agree.
Is there a specific course or something you've learned from one of our courses that really stands out to you that comes to mind as something that was really impactful on your occupational therapy practice?
You had a wonderful course. I mean, there have been so many. I mean, so like I said, so it's kind of hard to pick out one versus the other. For one thing, I like that you make ethics and jurisprudence immediately available to individuals, and you do a very good job at that. I know I just recently took those courses, so those are available. We don't have to worry about, oh, do I need to drive to Jackson, Tennessee for this? Do I have to go to conference and stay, just to get this on the last day? It's all right there for us. So those are essential for us to remain, certified and licensed here in our various states, be they Tennessee or any of the other states that you all service. So I think that's critical. I love you did one on one-armed adaptive dressing, which it was fascinating. And of course, I think your PEDS classes are very interesting. I am not necessarily focused on PEDS-based therapy right now, but I think you should always, as an OT, be open to learning something about an area, even if it's not your primary area of practice. So, the ones that you've had on pediatrics have been, great just to kind of inform general knowledge. And then, of course, when you have classes on mental health, I think those classes have been great. And then mindfulness. Those are really important topics because we can take those tools, and regardless of the population we're working with, whether we're working with someone in a rehab space or we're at a nonprofit volunteering, but we see that someone, is having some struggles, we can still reach out there to them.
So, what have you enjoyed the most about your experience with Aspire OT? And it can be any part of the experience from the time you open your computer or your phone until you log back out. What is the best part of your experience?
Well, I found that it's very easy to use. It's very easy to use. I can, you'll tell me ahead of time through through emails and other notifications what is going to be happening that night, and then a couple of days in advance so that I can make my notes that okay, I want to log on at this time. It's easy to get into the platform, and you can a lot of times download some of the resource material ahead of time so that you'll have it there to take notes as you go along. And then I'm still of that generation where I like to write my notes down. I don't put it in my phone or anything like that. But you have that ability, and then after all, there's an accountability factor. I actually like that you have an accountability factor where I need to know the code that was said during the presentation, so that way I have to attend to the presentation, and then also there's a quiz afterwards to kind of test my knowledge. So I actually like those accountability features you put in.
We appreciate that. If there was an OT practitioner or a student and they were kind of thinking about trying Aspire OT, what would you have to say to them, if they were kind of talking to you about it?
I would say it's definitely worth the value because you even sweeten the pot sometimes by letting them, if they attend one seminar, they can join as a member at a reduced cost. So you make it unbelievably easy and very affordable for these individuals to get the critical knowledge that they need to improve their practice, regardless of settings.
Affordability is really important to us. Affordability is access. And we just feel that every OT practitioner and student deserves to have access to quality education. We just don't feel like because it's affordable, that should mean it's not going to be as high quality or as beneficial or informative.
Yes, I completely agree.
So we're going to shift gears just a little bit, Karon. So can you kind of tell us any specific challenges or maybe pain points that you've had that maybe one of our courses or any of the other services that we provide has helped you face that or overcome that challenge?
Well, I think my pain point is kind of the same pain point as any occupational therapist, and that is actually explaining what we do and what our services are about, and also our distinct value. So I think that when you have your session on how to craft an elevator speech, that is priceless because it is a daily thing to explain to individuals about occupational therapy. And sometimes you can explain to them, and later on in the conversation, they're going to call you a physical therapist. So it's just like, okay, well, we're just going to keep at it, because I'm not a physical therapist, I'm an occupational therapist. So I think that is I mean, that's a pain point I think we can all agree on. Whether you're in a hospital walking in the room and they look up and say, oh, there's so and so's here for you. It's like, no, no, I'm not that service, I'm this service. Or you're out on the street trying, you assume you're out in various environments, meetings or whatever, trying to explain to them what you do.
That is definitely a challenge we face in practice. Absolutely. I face that every day as well. But I'm almost excited about it now.
Yeah.
I no longer dread it. I actually am kind of excited because I now see it as an opportunity.
Yes.
Whereas I think before, because I didn't feel as confident in my response, I did dread it a little bit. And now I'm like, oh, I hope they tell me they don't know what occupational therapy is so that I can tell them.
That's right.
Well,
I
we
know.
just
Yes.
appreciate
It's a
your
great
time.
storytelling opportunity.
We appreciate your time so much. Is there any final thoughts or anything that you have about Aspire OT or anything in general?
Well, for one, I do want to laud you all on your success. You have been in business for 4 years, and for anyone trying to, stay in business, it is hard out there, particularly starting off as a small business and as a woman-owned business. So I congratulate you, ladies, on everything that you have been able to achieve. And as you mentioned, you have a worldwide presence now. Please keep doing what you're doing. And if you have not joined Aspire OT, you need to now. You are missing out on high quality, affordable, and convenient education. And it's been my honor and certainly a pleasure to speak with you all today.